So if you smoke a hookah, then you will grow a third ear. Was that it?
Close.
Close.
Yeah.
Okay.
Well, we'll talk about it.
Okay. Well, all the top medical topics of the day coming up. Awkward moments with Lisa.
Yeah.
Dr. Ahluwalia is with us, and pay attention to this first one, because this truly is, I'm saying silent killer, but it really is.
And staggering. So, of course, 29 million Americans have diabetes, right, Dr. A? Thanks
Yes.
for being with us. But as many as 25% don't even know it.
Right. So, you know, when we look at the statistics and when somebody dies, we try to find out what was the cause of death. Most of the time it's stroke or heart disease or something else, not diabetes. Diabetes is very rarely listed as the cause of death. It's this underlying silent killer that makes you more likely to have a stroke, more likely to have heart disease. And it's pretty scary that a lot of the people don't even know.
Well, how does that happen? You don't get tested, you fall through the cracks?
The symptoms of diabetes are very subtle. So you feel more hungry, you feel more thirsty, you pee a lot more. Until you really develop it to a degree where you start to have sores that don't heal or other problems related to it, you don't find out. Or you go into a coma or something bad happens. So the key here is that if you're overweight or obese, if you are Hispanic, Latin American, African American, American Indian, you're more likely to have diabetes, and it's more important to get it checked. Just, you know,
and in your 20s even. I mean, sometimes we think of it as you get older.
It's getting a disease, yeah.
And if you're asymptomatic, you don't know you have it, the test will tell you. It's the only way to find out.
It's the only way to find out. Not only that, but you may be pre-diabetic. Up to 86 million Americans are pre-diabetic. That means they're almost there.
Can you stop it once you're pre-diabetic?
Yeah, with diet, lifestyle choices, a lot of things. If you lose weight, you may get rid of it.
Next, one of the biggest issues is painkiller. The relief from pain is a huge issue. Oftentimes, the relief from pain is worse than the pain. We've got a breakthrough maybe here?
Yeah, so, you know, it's staggering. The number of deaths from oxycodone and hydrocodone top cocaine and heroin combined. So we don't know this, you know, we don't realize this, but it's true. And you know, unfortunately, we struggle with getting patients adequate relief while still treating this you know, scourge of
addiction. Yeah.
So this new medication just came out, and the tablets are harder. It is more difficult to break it, to crush it into a powder. And as soon as you add any liquid to it, it becomes this gooey mass that you can't inject or do things with. So we're trying our best, but it's a difficult problem. Yeah.
All right. Now we got one for Roxy here. It has to do with, listen, smoking hookahs has become kind of a thing now, right?
You know, it's fascinating the way it's marketed and the way it's put forth. It seems very harmless,
like a sweet, fun thing you do with your college friends. Yeah.
So what's fascinating, and most people don't understand, is that they have charcoal that heats the tobacco, that goes through this pipe into water and comes out on the other side, and you smoke it.
All these chemicals.
Right. So number one, you're smoking charcoal smoke, which is indoors.
Okay.
Horrible.
Yeah.
Number two, you're using this pipe that other people have used, right? So who knows how well they clean it.
Roxy, do you change your own?
They have mouthpieces.
Yeah, I know.
You bring your own?
The pipe is the same.
Okay.
Number three, you are smoking for up to an hour at a time.
Yeah.
A cigarette only lasts for a certain amount of time, and you know how many you've smoked. When you're doing the hookah,
you have no idea. And what is it? Okay, sorry.
Sorry, third, they asked all these kids, you know, what do you think of it? Number one, the kids thought that the tobacco wasn't as bad. Number two, they thought the fruit and the tobacco somehow reduced the bad things in it. Number three, they thought that the water purified all the stuff that came through. And none of these is true.
None of that's true.
And
Roxy, did you know that?
Oh,
and benzene, which causes leukemia, is at much higher levels in the smoke that you inhale. But they also found out that people who just happen to be hanging around
secondhand benzene.
Secondhand. And it affects
2.5 times.
Menstrual cycle too.
It's horrible.
It does all types of
please,
stuff.
kids, if you're trying to think that this is better than smoking or if it's harmless, it's not.
Okay.
Quick reaction.
Once a year, Dr. A.
Once a year?
Once a year. What are you, liar? Yeah. Once a year. Do it more than that. Once a year.
I can't say yes.
He's a doctor first.
All right, thank you, Dr. A. As always, Dr. Ahluwalia, Sonu Ahluwalia.